Hi everyone, I am Dr. Ataur Rahman, consultant in internal medicine. Today I am going to talk about bronchial asthma. Bronchial asthma can be defined as a reversible airway obstruction. What does it mean? Reversible means the airway obstruction is happening for a short period of time and it is reversed with or without treatment. Bronchial asthma can be present in any age, especially in the children. Bronchial asthma causes 4,000 deaths in the USA annually, and about 7 to 8% people in the United States of America have been suffering from bronchial asthma. Bronchial asthma cannot be cured, but it can be prevented and it can be treated to some extent. And let us talk about what are the types of bronchial asthma. Bronchial asthma can be in different form: allergic form, occupational form, and also exercise induced bronchial asthma. Allergic asthma is that asthma which is triggered by allergens such as dust, pollen, animal danders, fumes, smokes, cockroach, etc. Occupational asthma is a kind of asthma which is triggered by occupational allergen, occupational irritants such as gas, fumes in a factory or in an occupational space. Exercise induced asthma, when someone is susceptible to asthma during the period of exercise in dry and cold air, that is called exercise induced asthma. Asthma can be dangerous, it can cause a death, so it is prudent to know that what is asthma and why it happened and what you can do. Your doctor will give you a Asthma Action Plan. What does it mean? Asthma Action Plan means whenever there is a attack of asthma, what you have to do. If bronchodilator like salbutamol or albuterol does not help, what you want to do. Now, when you need to go to doctor, when you need to go to emergency room, your physician will provide you a small device which we call peak flow meter. Peak flow meter is a small device which you are instructed to take a deep breath and blow out the air out of your lungs. Usually it is between 400 to 700 liters per minute, calculated based on your age and status. If 80 to 100% of your predicted value is reached on the peak flow meter, it is called green zone. You are in green zone means that your asthma is under control. When your predicted value is 50 to 80%, then it is called you are in the yellow zone. And when it is less than 50%, then it is called red zone or danger zone. In green zone, you don't need to take any action. In yellow zone, you may need, in green zone, you need medicine as needed, or you may not need medicine at all. Yellow zone, you need to take your medicine as instructed by your doctor, or you may need some adjustment as far as your written asthma action plan provided by your pediatrician or general practitioner. Red zone is dangerous zone. In that zone, your peak flow meter is less than 50% and you need to go to emergency room for intervention. Asthma allergen should be avoided as much as you can, and you are also required to take influenza vaccine every year and pneumonia vaccine every 5 years. If you are a smoker, please do not smoke. If you are not a smoker, please do not expose yourself to secondhand smokes. Secondhand smoke fumes, gas, irritants, dust, pollen, animal danders, cockroach, or any other irritant, even perfumes, sometimes can trigger your asthma. So write down a asthma diary that what are the triggers do you have. If you can identify your triggers, you can avoid the triggers effectively, and you can prevent asthma attack. Asthma should not take a toll of your life because treatment is available. Even though it is not cured, it is treatable. What is the cause of asthma? Asthma, the exact cause is unknown. However, genes may be linked to asthma and also environmental factors. Remember, try to avoid the circumstances that will trigger your asthma. Common cold, virus, or any other bacterial infection, or any stressful situation, intense heat or intense cold can trigger your asthma. If you know what triggers your asthma, it is better to avoid the triggers. Asthma is a reversible disease. Your asthma attack can be reversible with or without treatment. However, it is imperative to know what to do at the time of asthma attack and when asthma attack is impending. Please listen to your doctor and explain to your children if he or she has asthma. Thank you so much for watching this small video. I hope you have learned something, and keep watching and subscribing my channel, Dr. Ataur Rahman Khan, youtube.com. Thank you. Have a wonderful day, and please remain asthma free and no suffering for you or your family. Thank you.